Good morning, and thank you for joining us today. My name is Jamie Watts. I'm the Director of Events for the Newcastle County Chamber of Commerce. And we are thrilled today to have Dr. Kara Odom Walker, Secretary for the Delaware Department of Health and Social Services. A few housekeeping items. Everyone is on mute. Secretary Walker will go through her presentation, and we will have allotted time at the end for questions. If you have any questions, please utilize the chat box. Many times questions will pertain to your specific business, so I ask that you update your Zoom name to your name and your company to ensure an accurate answer, or put it in the question itself as well when you ask it. I would like to introduce our speaker, Secretary Walker. As Secretary, she leads the principal agency charged with keeping Delawareans healthy, ensuring they get the health care they need, and providing children, families, and seniors with essential social services, including health benefits, disability-related services, and mental health and addiction treatment. She oversees one of the largest departments in Delaware's government with an annual budget of more than $2 billion. Today, she will review Delaware's response to COVID-19, provide an update on where we are now, discuss plans for the future, and take your questions. Take it away, Secretary Walker.
Thank you, Jamie, for this opportunity. I greatly appreciate it. And just yesterday, I announced my resignation. I have to say, with the pandemic and with everything we've been through in the past months, it's been tremendous to see the number of people who have come together collectively and just moved the needle to make sure that we're saving lives and we're addressing the needs of our state. So I'm going to give an overview, but I also feel like I have to say everyone at this point is likely an expert in our response. And so I'll try to go through it quickly in terms of the retrospective view and really give some clue to the future. I am a family doctor by training. I'm not an epidemiologist nor an infectious disease specialist. And even those experts are still unclear as to the impact of the virus on our state's economy and the future, but I will certainly look forward to your questions and do my best to respond. Next slide, please. So I'll review where we've been, and many of you know that this all started from us looking back in the fall at a virus that was emerging from Wuhan, China. Next slide. We heard about this. We were starting to get alerts in our Division of Public Health and having briefings weekly about this virus that was emerging, certainly thinking about whether we were ready, and many of the preparations were reliant on previous experiences with SARS and flu to make sure that we had what we thought was the adequate needs in place. Next slide. But as all of you know, it quickly outpaced our typical preparations, and we saw community transmission on the West Coast. We were working closely with partners across the nation to understand its impact and understand what would happen when the virus was introduced to Delaware and reduce its impact. That was back in March, which seems like a decade ago. Next slide. Our first case in Delaware, in my opinion, was slow to come. We're very fortunate in that way. We were watching what was happening on the West Coast and north of us. But March 11th, we did have our first presumptive positive case in a man older than 50 associated with the UD community. And certainly part of the initial set of risk factors that was connected to travel or exposure to a traveler. And then were a few superseding super spreader events where that certainly led to this first initial case, and it was focused on the UD community. They were a great partner in its first response, and because I'm talking to the Newcastle Chamber, we all know that much of this started in Newcastle County with a huge response needed in the Newark area to make sure that we were keeping people and our students safe. Next slide. But quickly, we knew that we had to issue protections, and Governor Carney thankfully moved very urgently to issue the state of emergency, limiting gatherings to 100 or fewer, and formally extending the order to June 6th. That was basically the extent of his authority to do so. And we were already working with the public and the General Assembly to ensure that we were keeping people safe, and our General Assembly did not meet the very following week that they were supposed to go back into session. Next slide. We also saw a stay-at-home order that was issued along with a set of guidance around essential businesses that could remain open, and many others that unfortunately had to close to keep the public. Next slide. This then emerged to documenting Delaware's first death on March 26th. It was a 66-year-old man from Sussex County who passed away, hospitalized out of state, and did have some of what we're seeing as now the characteristic risk factors around underlying health conditions, and he was critically ill. Next slide. We also, unfortunately, also saw a hotspot in Sussex. So although we had been focused in Newcastle County and the university community, we very quickly saw we needed to respond to what was emerging as a hotspot in Sussex around essential workers who are working in the poultry industry. And those communities, Milford, Georgetown, Millsboro, Selbyville, certainly were a focus of where we needed to do outreach and testing. But these disparities around non-English speakers, those who spoke Spanish and Haitian Creole, were slower to hear information that they trusted in some ways. And so we had to ramp up our outreach and our testing sites that were partnered with local community leaders. We also had challenges making sure people were isolating at home safely, so we offered alternative residential placement, and very quickly saw that the highest number of positive cases continues to be in Sussex County because of this outbreak in the poultry industry. Next slide. So our first 100 days of the coronavirus in Delaware, next slide, went very quickly, but you can see here how it lays out from when we initially worked in March to issue the first state of emergency and stay-at-home orders. We then saw our deaths occurring in the nursing home. We saw the need to issue an order around face coverings. And in May, we very quickly had to refocus our efforts on community testing and making sure we had contact tracing established so that as we prepared to reopen parts of the economy and parts of the state, we could think about how to do it safely. And I'll go through that in some detail because I think it is critical for how we think about the new normal. It's also important to think about how we reopen beaches and how we try to emerge from this, thinking about how to keep people safe as they engage in their summer activities. In June, we also started phase 1 of reopening. We did some testing in the high rises in Wilmington to ensure that vulnerable seniors were protected, and then moved quickly this week to phase 2. We will continue to have contact tracing efforts stood up with additional capacity. And at the end of this month, you'll see much more robust workforce and IT technology supports to make sure that as we emerge and as we proceed through phases of reopening, that we can also keep an eye on where and when outbreaks do occur in the future. Next slide. We've also seen this case trajectory. So this is a slide from June 14th. You can see updates on My Healthy Community DE, but it shows the trends that we've been underscoring, that the overall state has seen cumulative cases grow, much of that driven by the cases in Sussex County and less so over time by cases in Kent. But we certainly have seen kind of a similar trend. What I think is important is that we have successfully flattened the curve because of the sacrifices of so many Delawareans, and we're greatly appreciative. Next slide. We also know that racial disparities in our state and in coronavirus have driven outcomes, and you can see, or maybe you can't see on this tiny slide on my screen, it's pretty tiny, but the trends are very startling, that many of our cases have been outpaced by the population prevalence of Latinos in our state. And again, it is because of who was working in essential businesses and where people live and work, and the risks that they've taken. And so you do see you know, the percentages differ by the underlying percent of racial groups in our state. So this is a challenge. It's one that we worried about from day one. And unfortunately, it was one that we had to track with accurate race ethnicity. We still have about 10% unknown race and ethnicity among those who have been positive with coronavirus, and more work to do on this trend. Next slide. You can also see on this slide that we're tracking our outreach to particular communities at risk among the number of total persons tested. And in this slide, you can see that there are more individuals who have been tested per population. In Sussex County, we have in some ways over-tested minority populations because of the concern about disparities and the potential to widen those. So you can see that we have tested almost half of the documented Latino population in our state at this point in time. There are about 7,000 Latinos, and we've tested about 4,000 at some point in time. We have more work to do to track this information and also make sure we're not missing pockets of outbreaks in the future. Next slide. This slide shows similar information to my last point, which is that if you look at the rate of testing by race, ethnicity, and per population, we are tracking what the rate is normalized per unit of population group. And so in some ways, we want to make sure we're not missing an opportunity, but I think it's really important for us to make sure we're testing by county, by racial and ethnic group that may be at risk, and that when you see it normalize, it really is important for us to see that in some ways we've done a lot of outreach to the Latino population and Black population, and that is appropriate because of the trends that we had been seeing in the past. Next slide. We're also concerned about racial disparities and those who have unfortunately died. We're very concerned about every precious life that we have lost. I personally have lost family members during this time, and it is absolutely concerning. We also want to make sure we're tracking the deaths by county and by racial and ethnic group, by age group. We are seeing trends among age group where those who are older with comorbidities are the most likely. In Newcastle County in particular, I would like to note that the trends among nursing homes drove some very concerning issues initially, and we have worked very hard to make sure those in long-term care facilities are protected. But additionally, we've been very concerned about the disparate deaths among, in overrepresented ways among those who are Latino and Black, and we're watching that. I think it requires a different strategy when other risk factors are present. Next slide. So I know that many people may have visited this dashboard at least once in the past 3 months to see where we're heading. It is updated, and we keep adding enhancements as we learn more and need to look at issues differently. But you can see the 6 key indicators that are showing our trends. And you can look at it over 30 days, 14 days, you can look at bar charts, line charts, whatever your preference. But it is interactive. You can look even in your zip code area, in your area, local area, in your county. And I think the trends are encouraging at this point, but we will continue to watch them and ensure that we're not going to see an additional bump in the coming months. Next slide. So where we are today, next slide, I will pivot to our goals, and I'm sure you will have questions about this, but the key strategy at this point has developed. I mean, when we started, you think about the fact that we only had one opportunity for testing, and that was through the Center of Disease Control. We took samples, we sent them to one location in Atlanta and waited for the results. Now we have many, many testing options, and we're ramping up to a point where we could do 80,000 tests a month in order to adequately reopen. The idea is that you test often and frequently, and you find those who are at risk to better be able to box in the virus, to box it in, isolate, quarantine, and find the virus so that we can keep society safe and keep us in a phase of a new normal while we figure out a cure or a vaccine for this virus. Next slide. We also know that for long-term care facilities, many of those who are most at risk do reside in our long-term care facilities, although we've put many protections in place, including restricting visitors and testing our staff. We are still unfortunately seeing the majority of COVID-related deaths in Delaware involving residents of long-term care facilities. They are the most vulnerable because of age and comorbidities, and they are certainly those that we're trying to make sure are safe, but it is challenging. On May 5th, the governor and Dr. Rattay, through her leadership at the Division of Public Health, announced universal testing of the residents and staff at those facilities. Starting June 1st, testing of the staff became mandatory, and the facilities had 2 weeks to complete this baseline. We're continuing to work collaboratively. We provided tests with a 1 month. We've provided each facility with a 1 month supply of tests, but we're going to have to continue to make sure that all of our residents are safe and not exposed to this very, very serious virus. Next slide. We also know that community testing is essential. On May 8th, Governor Carney announced an expansion of our testing program to those who are symptomatic, to anyone with known exposure, and also to those who just may be vulnerable. I think that's critical. They may be asymptomatic, but we wanted to make sure we were pushing this forward. We also will continue to regularly encourage frontline essential workers to get tested as we reopen. We are evolving this strategy, and May 8th seems like eons ago. Again, I think every day of living in this pandemic is a long one, but we're looking to the future and trying to think about what do you do and how do you encourage populations who may have lower risks, medium risks even, but still should be tested regularly or know when to be tested. Because being tested once does not necessarily confer immunity, and that is something that we really have to think about critically, guide the public in the right way, use science and policy, but also not create fear that isn't based on action points that someone can follow. Next slide. We also know that some of our most vulnerable seniors may not be getting out much, and we will continue to be in a state where our seniors need to stay in place and stay home, and those with underlying chronic medical conditions need to stay home and stay safe, again, until we think about the day that we have a cure, better treatment, or a vaccine. On June 2nd, we began door-to-door testing in 10 high-rise buildings in Wilmington, largely to make sure those who were staying at home and in place had access to testing, and fortunately did not see any major outbreaks, but we are working collaboratively with communities who may be interested and encouraged to continue to stay at home but want to know if they've had coronavirus at some point in time. Next slide. We're also continuing with the box and the virus strategy to develop robust contact tracing. We will hire about 200 Delawareans as contact tracers who are doing this work right now. The National Guard is supporting us in this way, and we are continuing to evolve this plan. Next slide. The goals of contact tracing are following those of boxing and the virus. That first, you have to isolate those who test positive and quarantine them. And then the next stage is to ask them about all of the contacts that they've had during the time that they may have been infectious, and figure out how to get them safely quarantined and help them monitor not only themselves, but their contacts to figure out when they're clear to go about their regular activities. The fourth component is essential to make sure that everyone has the resources to safely quarantine, including housing, food, and prescriptions. Next slide. We know that this challenge was extreme and inadequate early on. We have 2 state epidemiologists, and they have been working 24/7 since the beginning of this epidemic. And for that reason, we quickly were overwhelmed with the number of cases and the work that we needed to do to keep people safe. And for that reason, have been very creative about supporting and expanding our workforce in that way. But community tracing will help us connect with those contacts and develop resources that they need to prevent further transmission of the virus. Next slide. So initially we have sort of a homegrown IT system called RedCap, and we have public health epidemiologists that are supported by many case investigators who can do interviews and figure out what the exposures were. The National Guard is supporting us and doing telephonic contact tracing. They have language abilities and other career talents that have been completely invaluable. We would not have been able to do this without them. We also have 11 field contact tracers and public health community health workers who reach out to people who we can't reach by phone. Next slide. What to do next? So the pandemic is clearly not over for us in Delaware, and I think that's why we're talking today. It's going to take all of us to take on our individual risks and think about how we assess our own risks and go about activities in a way that is different, but certainly cautious for not only us, but our community members. Next slide. So we'll have a robust contact tracing plan activated by the end of, today's the 18th, by June 28th. And it will use a robust Salesforce platform to track every individual in a longitudinal way and provide a long-term view of how we make sure people are safe. We'll have additional public health epidemiologists to support the work and 138 or more telephonic contact tracers that are supported by a much more robust public health community health team to do the work on the ground and knock on doors for those that we can't get in touch with. So this is much more robust and organized and supported by a professionalized team at the University of Chicago, NORC, who's also supporting contact tracing in Maryland. And our partnership with Maryland has been critical as we emerge from the Sussex County outbreaks and thinking about the poultry industry. And so we've really seen that this could be an important way to track moving populations, and appreciate all of their partnership and collaboration. Next slide. So this plan has many partners. We also are leveraging expertise of a IT firm called Innovational. The 42 field contact tracers will have 3 field directors, 1 per county. The loss to follow-up is really a challenge, particularly as we think about how we track and manage those who may have been exposed and at risk. And if you think about it, the biggest challenge is how do you always know their contact information? You know, I may test positive, have been in touch with 30 people, maybe half I know really well and know their phone number. The other half, maybe I know their name or have to track them down. And so it's that sleuthing that really does take time and effort. Next slide. So this is what success looks like. It's a big shift from where we originally were, where, you know, positive patients would have gotten results back in maybe a week or 5 days, and then thought backwards about 8 days before where they were and what they were doing. Now we are at a place where, because of IT and the turnaround and the capacity of testing, we can think about reaching out to positive patients within 48 hours of a positive test. We can also make sure that their contacts are referred for testing within 48 hours. There isn't a challenge with getting access to testing, and we can make sure we reconnect with them if they did not get this lab test. We're also working to make sure that those who are socially vulnerable for housing, food, prescriptions, whatever they may need to stay at home, have the resources in place through our department in Health and Social Services. And we're thinking about how to make sure that that staffing work is very robust. So the idea and the goal is that efficient tracing and isolation of contacts reduces the infection rate to less than 1, meaning, you know, 1 person gets positive, they don't pass it on to more than 1 individual. And I think that is a goal. It's a robust one, but one that's critical to contain and see a downward trend in the virus and the prevalence in our state. Next slide. We are also being guided, and the governor has created the Pandemic Resurgence Advisory Committee to ensure that we have input for the future. And we're planning for what happens if there is an additional resurgence of the virus. There's a lens on health, equity, and business that will guide the governor's recommendations. This committee is co-chaired by Lieutenant Governor Bethany Hall Long and our Secretary of State. They're creating reports. The first will be due by July 31st and the second by September 30th. All are publicly posted, and you can join and listen in as members of the public. Next slide. We're also hoping school continues to proceed, thinking about safe reopening with a lens on health, wellness, academics and equity, operations and services. This group is working very hard to make sure we're paying attention to how our students need to learn. And as someone with 2 little kids, virtual learning is challenging, to say the least. I don't know if you've yet seen my daughter in the background, but it is no fun. So we're really trying to figure out how to safely reopen schools and continue to meet through September. Next slide. We just don't know much. I think in June, there was a New York Times story and it resonated. We don't know a lot about this coronavirus. And again, we're all in some ways new experts in what this is, because you know the same things I know, that we don't really know how many people have been infected. There's an asymptomatic portion where some people are just getting mild symptoms, or they're losing their taste and smell, and we don't know what that really means. I mean, maybe they've had it, but we don't know if they're now safe. We don't know if it's the amount of virus that they were exposed to that makes it different, or we don't know if it's something else related to underlying conditions and why some people get so much sicker than other. We've seen relatively healthy young people who have very active lifestyles unfortunately die from this virus, and yet we've had older individuals like my 91-year-old grandmother who somehow battled through this and is doing just fine with a brief hospital stay. So we really don't know much about this. We don't know about the role of children who have the capability of spreading the virus and being pretty well off if they get it. There are rare syndromic issues with the virus, and we also know that, very similar to getting a booster from a vaccine, it may be that you have some immunity, but not strong enough to really battle a serious exposure. So we don't know how long someone will be immune after infection. All of this we're learning in real time. We're sharing among scientists and public health leaders, but it is truly a challenge. Next slide. So we will have to pivot. I think there are so many things that we're learning, and I like to see things move forward as not only challenges, but also opportunities. We've lived through the challenges of shutting down the economy, but what we also want to make sure is that we're learning as we go, and that we don't have to think about shutting things down full scale again. And for that reason, we have to really think about prioritizing public health. We've had an underfunded public health system for quite some time. We are now rebuilding that with CARES Act money and prevention and primary care work. We're also making sure that we're focusing on services that can address the needs of the most vulnerable, and accelerating how we look at population-based health and inequities and health outcomes is critical. So I hope that we can also make sure that in the midst of racial instability and outcry, we also are able to refocus in a positive way on social determinants of health, longstanding differences, and these disparities post-pandemic. So with that little optimism, I will turn to questions. We are all in this together, and I appreciate the opportunity to present and address your questions, and I will do my best with all of the unknowns in the future. Thank you.
Thank you so very much. Please feel free to utilize the chat for the questions for Secretary Walker. We do have one from the Easter Seals that was pre-submitted. And they asked that they know there's been a lot of procedures being put in place at nursing homes to protect vulnerable citizens. What measures are being taken, and what assistance is available to protect people with disabilities in our communities who are also extremely vulnerable?
So, in some ways, we need to think about those with disabilities in the same light as our seniors who are in the community. So, those who live in residential facilities are institutionalized, have a very different set of risk factors where we can control the environment to some extent. And the most likely reason that they are going to be exposed is staff. But we have made a huge movement to make sure that those with disabilities are living in our communities and are supported by robust programming. Unfortunately, what that means is there's been a major disruption to those communities that help people manage and have a routine and have supports in place. But the challenge is just, as we've seen, that those same programs and staff and rotating activities can create risks. Part of our strategy around making sure we have robust testing available is that those who are working with at-risk populations can get tested regularly. Now, it'll really depend on the circumstances, whether regularly means every week, every month, or whether they need to limit the number of clients they have. But certainly at a baseline, it needs to include PPE and how we actually think about keeping individuals at a lower risk category. And that is going to be a case-by-case scenario as we move to a new normal. Under our Division of Developmental Services, we have worked really hard to make sure providers have additional resources in place, not only technical supports, but also funding to make sure that those accommodations can be maintained. But really appreciate working collaboratively to figure this out. And it will take families and caregivers and care teams thinking creatively. So we will not create policies that's one size fits all for this situation. Thank you, Jamie.
Thank you. We also got another question. Do we anticipate an answer in the near future regarding if the virus conveys any short-term or long-term immunity? And along with that, if you suspect you were infected and recovered, should you get an antibody check?
So the first question around long-term immunity is challenging. We don't know. We don't know much about what level of protection is needed for long-term immunity. And if you think about, our vaccines that we receive, whether it's mumps, measles, rubella, there often is a booster that's required because we know a lot about the immunity necessary to keep you safe and healthy. What we don't know for coronavirus is what extent you need those antibodies and at what level before you're really truly protected. So the challenge with antibody testing is, one, they have not proven to be very predictive in figuring out who is positive and what behavior changes are necessary. We can use, there are two different antibodies. One indicates acute infection, IgM, the other is IgG, that's long-term protection. But what we don't know is if you test negative, what that means. Does it mean you truly are protected, you have never been exposed, and how long are you safe? I mean, if you are negative, completely negative, do you get to go about your usual activities, and when should you get tested again? So that is the challenge of not having great antibody tests. So, in some ways, I would not say we should just test the entire state for antibodies at this point in time and use that to predict policy, because there aren't great tests yet. And we're hoping to get there, but we're not there yet. And we don't really know what level of immunity is protective. I do think that will change. We do see new technologies coming on board in the coming weeks and months. And so stay tuned, stay just tuned to the same news channels that you listen to. And we hope that we will have additional resources. If you did have symptoms and you think you might have been exposed, I would recommend you talk to your doctor because it may be that given your particular circumstances, you should have an antibody test or you should go get tested. And that could be helpful given your particular circumstances, but it is not a blanket recommendation at this point in time.
Right. Thanks, Jamie. And of course, and in addition to staying on top of the news, also make sure you watch those governor press briefings on Tuesdays and Thursdays. We get a lot of great information from those as well. Question from Linda Neef. What are your thoughts around at-risk elementary schools? At-risk elementary students with respiratory illnesses like severe asthma returning to school in the fall? Now that we know those children are often plagued with absences from school due to respiratory issues in general, will there be special accommodations made for those particular students in the fall? I know you may not know what the schools allow, but what are your recommendations for children with these with severe asthma and other illnesses like that?
Yeah, I think, again, it's a little bit of an unknown. What we are seeing is that the underlying health conditions for kids are different. And I've seen a study that says that, kids are really asymptomatic, even those that usually would be most at risk for things like flu, right? Where for flu, we're very worried about kids with underlying respiratory conditions. We're very worried about, kids with diabetes and disabilities and, other risk factors. For some reason, this virus is just treating those children almost the same. But I do think that the fall will be a lot of challenges when we start to see coronavirus circulating with the flu. And I would, at this point, say that we need to be overly cautious around flu and the usual upper respiratory infection, which could be coronavirus or it could be the flu. But either way, we don't want those risks to impact our vulnerable kids. And, I think schools are going to be thinking about how to maintain education virtually for children who may be out because they're sick or out because they might be sick and just need to, if you have sniffles, please stay home. It might be coronavirus. Well, there needs to be some thought to making sure we're not creating educational gaps for our children. But this is all thankfully guided by our team who's working on the school strategy. And I know they're trying to figure out plan A and plan B that will likely change and evolve on a weekly basis.
Right. To as your point, there's so much that we don't know, and we're kind of figuring it out as we go through this. And kind of to piggyback off of that, Sarah would like to know, when should we expect a second wave of the coronavirus in the United States, if we should expect it, and then what can we do to prepare for that?
So I wish I knew. There are lots that I wish I knew, and we don't know. I mean, we're watching even what's happening in some states south of us, like Florida and Arizona, that are seeing what appears to be an increase in the number of cases despite, a transition and despite caution. I think that is what we don't know. We don't know if, the impact of reopening beaches in Delaware will lead to a bump in Sussex. And so I think we all have to continue to behave cautiously, wear masks when we're out. We're hoping not to see another resurgence in the fall, but I am not confident that we will have the ability to say we have this virus completely under control in the fall as it mixes with flu, the usual flu. The symptoms are very similar. We certainly lose many lives due to flu. And it may just make it very challenging to figure out when and where to get tested. So we'll have to work on that. But I am listening to the experts globally around what that may look like. And many are saying we will see some resurgence in the fall. We just don't know how bad it'll be, which is why contact tracing is important, figuring out our new normal. What are the risks we're willing to take and not take? There are some things I don't think we'll ever get back to doing until we have a vaccine. And other things that we'll say, it's worth some minimal risk. And we just have to figure out what that looks like for each and every family member and each and every environment that we're in.
Right. And then Linda has a question specifically around clarity about the numbers. Do the numbers of positive cases include everyone from day one? In other words, does the numbers include those who recovered and is cumulative from day one?
Yeah, so there's a slide, I'll draw it with my finger, but it kind of goes like a big, flattens out. It's total cases, that's cumulative total cases. And what you expect is that number will, continue to rise, but as you flatten the curve, you'll see it just even out and go flat line. That's the goal. The goal is not to see it continue to go up again. And we're hoping that, again, we will continue to see that number stabilize. The challenge is just as you've said, there probably are cases that we haven't caught either because people did not realize they were exposed, or they were completely asymptomatic and had very mild symptoms, if any at all. And then some early on may not have been able to get testing because we had a limit to the number of people who could access. And even among the essential workforce, some people just said, this is just too complicated. I can't figure out how to get an appointment, how to get a test. We don't have the mobile pop-ups yet operational. And so people probably were exposed and did not get tested. And we just don't know how we would ever capture that. I think that is the challenge, but hopefully going forward with additional capacity and testing, we will catch more of the cases and more of those who may be asymptomatic and doing relatively well, but have the virus.
Right. Okay. I don't see any other additional questions in the chat. If you do have a question, please submit it. We'll give it another second or two. But Secretary Walker, we really do appreciate the time that you took to present to us today. And also congratulations on your new opportunity. You know, you will be missed for sure in our states. But we appreciate, even specifically from the Chamber, I know that the My Healthy Community website and all of the resources have just been a wonderful asset for us to be able to share with our members and our community. So we truly do appreciate the work that you have, that you've been giving us, helping us with over the last, few months. That feels like it's been so long, but it's, it's been since May, but since March, but it feels longer than that for some reason.
I exactly the feeling. Every day is a new adventure. I have to also say, a tremendous team who has helped pull together resources and supports. And Dr. Rattay is such a rock star. Her team has just done yeoman's work, and I just can't thank them enough for their public service and sacrifice. And Governor Carney is truly an amateur epidemiologist these days, and I think has earned his degree and has studied the data, and I could not imagine a better leader right now for our state, given this pandemic and this challenging time. So thank you. It was an honor to serve in this role, and I'm happy to answer additional questions offline if you have them. Thank you so much, Jamie.
Perfect. Thank you. And thank you all for joining us today. Stay safe and have a great rest of your day.